I know they can be done predictably. I know I'm going to enjoy them, and I know I'm going to have happy patients. It's a win-win for everybody. Hi, I'm Robert Glover, clinical lead at the Mount Dental Practice in York. I've been using Quoris for 9 months now. Did the course in June last year. It's been a big change, really beneficial to the practice and to myself and patients. So I use Quoris for GuidedSMILE. Did the course, absolutely fantastic. And I also use them for guided crown and guided bridge. Also use them for making crowns and bridges for implants where I've not done guided surgery. So effectively, I'm using them as my lab for all my implant work. So I've been really impressed with Quoris. It's a lovely team to work with. You can pick up the phone, speak to whoever's working on your case, email them. They send you the cases as a little video before manufacture for you to approve. They're happy to make changes, very easy to work with. And the communication's really good. They're just a really nice bunch of people to work with. Compared to other labs, they're just very accessible and very happy to listen, very happy to do the best for you. It's a really good way of working. Quoris make quite a difference to the way of working. It's headed by dentist James Hamill, who's got incredible expertise. His team is really well trained. They understand things clinically really well. When they send cases to you to approve, you get a real feeling they understand what's going on. They understand the anatomy. They understand what's important to you and how it is for you to do the surgery and get the best outcome for the patient. The whole ethos seems to be founded on education. At the Larry Brown Centre, it's very well put together, a lovely team to work with, and they have the knowledge, and you can pick up the phone, speak to somebody or email them or even text them, and they will give you a response quickly. If the technician working on your case can't answer the question, they will escalate it to James, and James will personally look at things that are a bit difficult, a bit out of the ordinary. You really do feel supported in a way that other labs I don't think can do, because there isn't a clinician there, and I think it makes a real difference to the outcomes for both you as a clinician and to patients. So I signed up to do the GuidedSMILE course, more from interest than anything else. I thought it was about time I learned more about guided surgery. And I went to do the course, and it was an absolute turning point. As soon as I saw this, I realised this was really the way that we should be doing full arch implant dentistry. It's reliable, predictable, it's quicker to do the surgery, which is better for the surgeon, better for the patient. It's going to lead to a better outcome. And overall, from start to finish, the treatment is much quicker as well. And overall, it's more cost effective, both for the practice and for patients. It really is the way to do full arch implant dentistry. The system's a benefit to me as a clinician because it reduces surgery time, but more importantly, it reduces surgery stress. I know that I'm going to get the implants where they need to be predictably. So GuidedSMILE is much more precise than conventional full arch surgery. There's no risk that the guide is going to move around and get the implant into the wrong position. The planning matches the guide precisely, and you know what the outcome is going to be. Medical legally, it provides a full trail from start to finish, demonstrating correct planning and execution of the surgery. It really does reduce the stress for the clinician. In a nutshell, GuidedSMILE has just made such a big difference for me because my patients are so pleased. It's life-changing, and they're all so pleased, and the surgery is easier to perform, less stressful, and it just made my life easier. And I look forward to doing full arch cases. I know they can be done predictably. I know I'm going to enjoy them, and I know I'm going to have happy patients. It's a win-win for everybody. I definitely recommend GuidedSMILE to all implant surgeons doing full arch surgery. It's very predictable, you'll have happy patients, and it's very cost effective. It reduces the surgery time massively. I initially did the course out of interest, and it's just transformed things for me. I definitely recommend it.